Okay, so here's something that I think about quite a lot. Every single day, somewhere in the world, somebody sits in front of their doctor or tries to with a symptom that's been bothering them for weeks, maybe months, and they've been putting it off, telling themselves it's probably nothing, that they're too busy, that it will go away on its own. And sometimes they're right. But sometimes, and this is the part that keeps doctors like me up at night, sometimes it's not nothing. And the difference between catching something early and catching it late can literally be the difference between life and death. I'm not saying that to scare you. I'm saying it because it's true and because I think you deserve to know exactly what your doctor is looking for. So I've spent nearly a decade working in NHS emergency departments, some of the busiest A&Es in the country, and I've seen both sides of this. I've seen people who came in with something that seemed minor and turned out to be serious, and I've also seen people who waited far too long because they didn't know the signs. So today I want to give you something genuinely valuable. I want to give you the information that doctors are trained to act on the actual red flags from NICE, which is the National Institutes for Health and Care Excellence, the body that sets the clinical guidelines that GPS and hospital doctors across the UK follow. These are the symptoms, the combinations, the specific ages at which certain symptoms become urgent. And I want you to know them because knowledge is literally the best early warning system you have. Let's start with colorectal cancer, which is cancer of your large bowel, because this is one of the most common cancers in the UK, and one where the NICE guidance is actually really specific about age and symptoms. Colorectal cancer develops in the large intestine, either at the colon or at the rectum, and it's the fourth most common cancer in the UK. The frustrating thing about bowel cancer is that early on it often doesn't cause any dramatic symptoms. It can be really subtle, which is exactly why people dismiss it. Now, here's where it gets really important, and I want you to pay close attention to these combinations, because they're what the NICE guidelines specifically highlight. If you're over the age of 40 and you have unexplained weight loss alongside abdominal pain, not weight loss because you've been eating less or exercising more, but genuinely unexplained, then that needs investigating urgently. If you're age 50 or older and you have unexplained rectal bleeding, blood from your back passage that you haven't been told has another cause for it, like piles or hemorrhoids, then this is an urgent 2E weight referral. Full stop. If you're 60 or over and you have either iron deficiency anemia or a persistent change in your bowel habits like going more often, going less often, or your stools changing in consistency, that also needs urgent assessment. Now for younger people under 50, rectal bleeding combined with any of the following, which are abdominal pain, altered bowel habit, weight loss or iron deficiency anemia, that also needs to be taken seriously and investigated. The key word across all of this is unexplained. If your GP has already told you that your bleeding is from a hemorrhoid and you've been treated, then that's different. But new unexplained persistent symptoms, especially in those combinations, they need to be acted on. Now, let's talk about lung cancer. And I know some of you might be thinking, well, I've never smoked, so this doesn't apply to me. But I need to stop you there because while smoking is the biggest risk factor, and I mean significantly the biggest risk factor, lung cancer does also occur in non-smokers, and the symptoms are the same regardless. Lung cancer is the most common cause of cancer death in the UK. It often doesn't cause symptoms until it's in a more advanced stage, which is part of why the early warning signs matter so much. The NICE guidelines are clear here. A persistent cough lasting more than 3 to 6 weeks that is new or has changed in character needs to be investigated. Not a cough from a cold that is cleared up, not a tickly throat, but a persistent unexplained cough. The next one is hemopsis, which is coughing up blood. This is an urgent red flag. No matter how small the amount, even small streaks of blood in your mucus when you're coughing need to be taken seriously. And if you're short of breath or you have chest pain, then that could be a blood clot and you need to go to the hospital right now. Persistent breathlessness that's new or worsening, or unexplained chest symptoms, or unexplained fatigue or weight loss. These are the things that NICE tell GPS to act on with a chest x-ray within 2 weeks. If you have any of these symptoms and you're a smoker, then you need to be even more proactive about getting that appointment. Next up, and this one is for everyone, and I do mean everyone, is breast cancer. And yes, while it predominantly affects women, men can also get breast cancer as well. And it's often diagnosed later because men very often never think to check. Breast cancer is the most common cancer in the UK overall. It's not the most common cause of cancer death, but it's the most common cancer. Now, the good news is that when caught early, outcomes are generally very good, which is why knowing what to look for matters so much here. The primary red flag is a new unexplained lump or mass in the breast. Something that wasn't there before that's persisting and that you can feel but you can't quite explain. Alongside that, we also look at skin changes to the breast. Things like puckering or dimpling or redness or a change in texture that sometimes looks like orange peel, as well as nipple changes, particularly new inversion where the nipple starts to turn inward when it didn't used to, or unexplained nipple discharge. Unexplained swelling in the armpit, because that's where the lymph nodes that drain the breast sit, is also a red flag. In practice, most UK GP pathways will fast-track investigation in anyone over 30 with an unexplained breast lump. But the key message is this: if you find something new in your breast that persists beyond your next menstrual cycle, or that you simply can't explain at any age, you need to see your doctor. Check your breast regularly so that you know what's normal for you. That way you'll actually notice when something changes. The next one is really important, but really underappreciated, so pay close attention to this one. We're talking about ovarian cancer. This one really matters to me because it has a reputation, and in some ways a deserved one, for being the silent killer. And I've seen a few cases of this over the years. So ovarian cancer is often diagnosed at a later stage because the symptoms can be vague and easy to dismiss or put down to other things. In fact, many women are told for months and months that their symptoms are IBS or stress or digestive issues before someone eventually investigates properly. The 4 key symptoms to know are persistent bloating, not the bloating that you get after a big meal, but a persistent ongoing bloating that isn't resolving, feeling full quickly when eating, or a loss of appetite that's new and unexplained, pelvic or abdominal pain, and urinary symptoms like needing to go to the toilet more urgently or more frequently than normal. Now, individually, any one of these can be caused by completely benign things, but if they're persisting, if they're happening regularly more than 12 times a month, is a figure that NICE references quite often, and if they are new and unexplained, then your doctor should be checking a CA-125, which is a blood test, and then arranging an urgent ultrasound. The risk of ovarian cancer rises significantly after the age of 50, particularly after the menopause, but it can affect younger women too. I've seen it. So please don't dismiss these symptoms as just being your stomach or hormones without getting them checked, okay? I want you to remember one thing from this next section. Just one thing, and it's this. If you ever see blood in your urine, then you need to see your GP. We're talking about bladder and urological cancers here. The headline symptom is hematuria, blood in your urine. And if you see blood in your urine and there is no obvious explanation, that needs to be assessed urgently. It might be pink, it might be red, or even dark brown. I'm not saying it's definitely cancer. There are plenty of other causes like urinary tract infections, kidney stones, and others. But visible unexplained blood in your urine is always a red flag and always needs to be investigated, no matter what your age is. NICE is unambiguous about this. Now, beyond visible hematuria changes in your urinary flow, urinary frequency that's new and unexplained, or any other urinary symptoms in people with significant risk factors, particularly smoking, because smoking significantly increases your bladder cancer risk. All of those need to be assessed. Older age increases the urgency of investigation here. If you have blood in your urine and you have no obvious explanation, like a known UTI that's being treated, then please book an urgent doctor's appointment. Now, this one is all about skin cancer. And the reason this is interesting is because you have the opportunity to catch it early, just by knowing what to look for. The most serious form of skin cancer is melanoma. And while it's not the most common skin cancer, it is the most dangerous because of how quickly it can spread if it's not caught early. The good news is that if it is caught early, then it's very treatable. The ABCDEE rule is what you're looking for with moles or potential melanomas. Asymmetry, where one half of the mole doesn't match the other. B for border, which is irregularity, where the edges are ragged or blurred. C for color, or color variation, where you're seeing different shades of brown, black, or even red or white within the same lesion. D, which stands for diameter increasing over time. And E is for evolution, meaning any change in size, shape, color, or new symptoms like bleeding or itching. A new mole that's growing or changing or looks different from your other moles needs to be assessed. Now, beyond melanoma, there are other skin cancers as well. So a sore or an ulcer on the skin that isn't healing after several weeks, particularly on sun-exposed areas, also needs to be checked. Right, let's talk about blood cancers now. So these are leukemia, lymphoma, and myoma. And these are cancers of, the blood, but also the lymphatic system. Now, the symptoms could be quite varied and non-specific, which is part of what makes them really challenging. But there are some key things to look out for. Persistent unexplained fatigue that's beyond normal tiredness. The kind where you're sleeping enough, but you're still feeling completely exhausted. Unexplained pallor, looking very pale more than usual. Persistent unexplained fever or night sweats, where you wake up in the night, drenched with sweat. Recurrent infections or infections that are more severe than you'd expect. This can be a sign that the immune system isn't functioning properly, unexplained bruising or bleeding, bruising that appears without any injury, or bleeding that takes longer to stop than it should. Another one is swollen lymph nodes. We mentioned this in breast cancer, but this is particularly important here. So you might notice lumps in your neck or your armpits or your groin that are persistent. That's important. And painless, that's also really important. Persistent and painless. And in some cases, a feeling of fullness or discomfort in the abdomen, which can be caused by an enlarged spleen or liver. Any of these symptoms, particularly in combination, warrants urgent blood tests, particularly a full blood count. Your GP can arrange this usually within a day or two. Failing that, just go straight to AANDE. The next one I want you to think about really carefully because the symptoms can be really easy to explain away as something else entirely. We're talking about brain and central nervous system cancers. These are relatively rare but clearly very serious, and the symptoms are dictated by where in the brain a tumor might be developing. The key red flag here is progression. Symptoms that are getting worse over time rather than staying the same or improving. A progressive neurological deficit is what the NICE guidance specifically highlights. Things like weakness on one side of the body that's worsening, coordination problems that are developing, new visual disturbances, new speech difficulties, new cognitive changes like memory or personality changes, persistent severe headaches, particularly headaches that are worse in the morning or that are waking somebody up from sleep or that come on with vomiting. All of these can be a red flag in the right context. It's worth saying that most headaches are not brain tumors, obviously. But a headache that is genuinely new, persistent, progressive, and not explained by other causes, especially with any of the other neurological symptoms that I've just mentioned, it needs to be investigated with a scan of the head. Adults with progressive neurological symptoms should be seen urgently, and in children and young people with new abnormal neurological signs, then this referral should be happening within a day or two. Here's one that people often haven't heard of, and I think that's actually part of the problem. This section is all about sarcomas. These are cancers of the connective tissues like muscle and bones and nerves and fat, and they are less common than some of the others that we've talked about, but they do occur, and the key red flag is actually quite simple. An unexplained lump anywhere on the body that is growing, especially if it's deep to the skin, meaning it feels like it's sitting below the surface rather than in the skin itself, especially if it's larger than 5 centimeters, and especially if it's firm or hard. Any lump that you notice is getting bigger over weeks to months, and that you can't explain needs to be assessed with an ultrasound and potentially an urgent referral. This applies to children and young people as well, where suspicious lumps need very urgent investigation. Don't assume that because a lump isn't painful, then it must be fine, because many sarcomas are painless in the early stages. And then there's something that might seem vague, but is actually one of the most important flags in this entire list: unexplained weight loss. I've mentioned this briefly, but let's just go over this again. So if you've lost a significant amount of weight without trying, without a change in diet or exercise, without another explanation, and that weight loss is persistent, that needs to be investigated. Multiple different cancers can cause unexplained weight loss as one of their first symptoms. And NICE, the National Institute for Care and Excellence, is clear that unexplained weight loss alone warrants urgent investigation. Even when there isn't another obvious localizing symptom pointing to a specific part of the body, don't put this one down to just stress or just getting older. Get it checked, ring your GP. So let's bring all of this together because I want to leave you with something really actionable, and I get that there's a lot of information in this video. So the theme running through every single one of these is the word unexplained. Symptoms that are new, that are persistent, generally we're talking weeks rather than days, that don't have an obvious already established reason for being there, and that aren't improving with simple measures. That's when you act, and acting means booking an urgent GP appointment. Not AANDE necessarily, unless something is actually dangerous, but your GP, who is the person with access to all of these referral pathways and investigations. I completely understand how difficult it is to get an appointment, but just be persistent. Say the red flags that I've mentioned in this video, and hopefully you'll be seen sooner rather than later. And let me just say this one more time because it's so important in this video. Early detection saves lives, not in a vague abstract way, in a very real, very measurable, very significant way. The difference in survival rates between early and late stage diagnosis for most of these cancers very often